Hi, this is Dr. Maria Sampoulos. Thank you for watching Corporate Optometry on YouTube. Today we're going to talk about corporate optometry myths. There's a lot of myths out there, a lot of stuff out there, and I want to debunk those myths about corporate optometry today in this video. So a lot of corporate ODs are allowed to practice the medical model. They're able to provide quality care that they want. They do have a work-life balance. So I kind of wanted to talk about those today. So myth number one. They don't practice medical. Many of the offices have a wide range of patients that they see. A lot of them have OCTs, retinal photography, visual fields. They have a dry eye clinic. Optometry is evolving. Corporate optometry is evolving. So a lot of that technology is used in the offices. A lot of ODs don't sell glasses in corporate setting, so they need to expand their scope of practice and also be able to compete with low reimbursements. Number two, they don't provide the same quality care as private offices. So we all have the same degrees. We all practice how we want, and we give the same quality of care to our patients. The four walls that we work in do not define our quality of care. And many times we see a lot of patients based on volume. And I think that's a great way because we're able to provide good quality care because we have the latest technology in our offices that a lot of other offices don't, and we get the corporate discounts to be able to have that in our office. So, number three myth, there's no work-life balance. I'll tell you, I've worked in corporate settings most of my career, and there is a work-life balance if you choose to. If you want to work more than one location, you have the flexibility to do so. If you want to work part-time sublease and have a family, you're able to do that as well. You just need to plan accordingly ahead of time on what you want to do in that sublease. And a lot of subleases are very flexible for that. And if you find an associate doc, it just gets easier. If you had a private practice, you'd be doing the same thing. You don't want to turn patients away. So the fourth myth is patients only come to the office because of the optical brand. So sometimes because of the marketing techniques, we get a lot of patients in corporate optometry. But I'll tell you, patients stay because of the doctor. The doctor is an integral part of why patients stay. The technology that our offices have, the way we practice, the way we are able to spend time with our patients and build our own personal brand is the reason why a lot of the patients, stay in the practice. They might come to the practice because of good marketing and brands with glasses that the corporate optical has, but they stay because of the doctor. And the fifth myth is that corporate optometry always focused on eyewear, not eye care. And many of the big initiatives in corporate optometry is being able to retain the patients. They know that's important, especially with increased competition, and patients to refer their friends and family as well. So, a lot of corporate opticals have invested in optometry lanes, advanced equipment to be able to differentiate themselves from other offices and online competitors, but to also make a wow factor to these patients as well. So if you think that corporate optometry is something that it's not, relook at this video, look at corporate optometry myths on Facebook, on my Facebook group, and some articles as well that I've written over the years. And if you have any questions, feel free to email me, corporateoptometry@gmail.com.